Remember that gout almost never occurs in premenopausal females. It is of low prevalence, that is almost 1 to 6 per 10,000 in women aged less than 60 years, and is 5 to 6-fold higher than this in males aged 40 to 50 years. Environmental factors such as dietary purine intake, alcohol consumption, and the use of drugs such as diuretics contributes to the development of this condition, because diuretics decrease the urinary uric acid excretion, which along with the reduction in the extracellular fluid results in hyperuricemia. Inherited metabolic abnormalities also contribute by causing overproduction or underexcretion of uric acid. How this metabolic error develops is quite interesting. Just be with me and let's go through a flowchart for a normal metabolism study.